Well, good afternoon, everyone, and welcome to today's GAHE webinar. I'm Bruce Lloyd, GAHE's Executive Director, and it's my pleasure to introduce GAHE President John Keevan, FACHE, MHA-RN, who's Senior Vice President and Hospital President of Wellstar Cobb Hospital. John, you want to take it?
Yeah, thanks, Bruce, and welcome everybody. Really excited for today's discussion. Really interesting, timely topic. Today we're going to be talking about creating coalitions in communities of color to increase COVID-19 vaccine confidence. Going to be very interesting. We've got a pretty packed agenda, so I'm going to take just a couple of minutes to talk about some chapter business. Want to start, as always, by recognizing our sponsors. We couldn't do this without them. Wellstar Health System is our platinum sponsor. Our gold sponsors are Piedmont Healthcare, Metro Atlanta Ambulance, Vocera, and Sound Physicians. And our silver sponsors are DT Spade, Nagel & Associates, SSR Inc., and Vizia Technologies. Please check out our sponsors. They do this to help us put on great events like today. We can thank them by engaging and having a conversation with them. Want everybody to mark your calendars for some upcoming events. You can see the screen here. We've got some really exciting ones going on. Coming up June 12th, we have Women in Healthcare joint networking event at the Braves game. That is sold out, so we're excited to have that. There's 40 people going to that. On June 16th, HBSCA Healthcare at Duke Atlanta Alumni Healthcare Cohort Evening Speaking Series. So some great opportunity there to get involved. And then you can see June 29th, we've got an in-person networking event. We're excited at Pontoon Brewing. So come by in person, register for that. We're going to have some networking and just get to know everybody. Want to highlight, we are partnering with the University of Alabama at Birmingham. They do webinars every other month, some great topics. We're partnering with them to help promote that event. The one coming up on July 14th is a panel discussion on the top 10 things healthcare executives should be doing regarding cyber security. You can get an hour of qualified credit. That's on the GAHE website, so go register for that virtual event through UAB. And then July 21st, we're back to an in-person lunch at Maggiano's. Encourage you to join us. Always a good time. Details and registration will be coming out soon for that. You can always visit www.gahe.org and see where these events, what all's going on. So please go to the website if you have questions. We also want to remind everyone we've got some ways to stay connected. Certainly the website I mentioned, but we've got Facebook, LinkedIn, and Twitter. You can see what's going on with GAHE and how to engage through those forums as well. Want to encourage everyone, if you're interested in being more involved in GAHE, we've got a lot of volunteer opportunities. Shoot myself or Bruce an email or admin@gahe.org if you have an interest in getting signed up. Today's program is going to offer an hour of ACHE qualified credit. You do have to self-report that, so as a reminder, go to My ACHE and add those credits to your account. And our moderator today, I'm happy to introduce for our topic again around creating coalitions in communities of color to increase COVID-19 vaccine confidence. Today, we've got an exciting panel, and our moderator is Dara Edwards. Dara is the Director of Pharmacy Services at Southern Regional Medical Center in Riverdale, Georgia. As a healthcare professional and researcher, for more than 20 years, Dara is very experienced in creating alignment between large hospital systems, physicians, senior leaders, and community resources, and all this working to increase access to quality care and promote health equity, hence our topic today, across disenfranchised communities. She's previously served in leadership roles at Wellstar Cobb Hospital. She obtained grant funding from foundation, state, and federal sources to implement continuity of care programs, reducing overutilization of emergency services for pediatric asthma patients, reducing readmission rates for patients with chronic heart failure, COPD, and increased medication access to uninsured and low-income patients. For the past 2 years, Dara has been at the forefront of coordinating and leading efforts to increase COVID-19 vaccination rates. Hence why we've got her moderating today, and cultivating community coalitions with Clayton County Public Schools, the Department of Public Health, and Clayton State University to improve health outcomes for Clayton County residents. Dara, we are really appreciative of you joining and moderating today. You've got a really unique background that I know we're going to learn from. And with that, I will turn it over to you.
All right. Thank you so much, John, for that wonderful introduction. Thank you, Bruce. And I just want to thank GAHE for this opportunity to share the power of creating coalitions in communities of color to increase COVID-19 vaccine confidence. I'm going to share my screen. And as you mentioned, I'm Dara Edwards, the Director of Pharmacy of Pharmacy Services at Southern Regional. And my co-presenter today is Ms. Janetta Greenwood, and she is the K-12 Science Coordinator for Clayton County Public Schools District. So our goal today in this presentation is to demonstrate how creating intentional coalitions among all major community institutions are essential to developing self-advocacy and individual engagement in marginalized communities to achieve improvements in health outcomes. Specifically, how Janetta and I collaborated to evaluate, educate, and influence decision-making among adults and children in Clayton County to increase confidence in the COVID-19 vaccines for themselves and for their families. So let's go ahead and get started with explaining why predominantly Black and Hispanic communities are, particularly in economically depressed neighborhoods, have disparate outcomes with COVID-19 infection relative to predominantly white communities. According to analysis conducted by the CDC, the Centers for Disease Control and Prevention, minorities and low-income communities are at increased risk of exposure to COVID-19 due to their high dependence on public transportation, overcrowded housing, which is defined as being more than 2 occupants per bedroom, and they work in essential occupations, notably retail and food services, and may often work in those essential occupations that may have limited or unpaid sick leave. Additionally, there's an increase in the risk of severe illness, which results in increased hospitalization rates. In Metro Atlanta alone, Black patients with COVID-19 were more likely to be hospitalized than white patients throughout the pandemic. And within the first 2 months of the pandemic, 79% of those patients who were hospitalized with COVID-19 were identified as Black or African American. And then the contributing factors to that include access to health care and the prevalence of comorbidities such as diabetes, hypertension, and obesity. And so with an increase in disease severity and hospitalization, you also have an increased risk of death. The CDC evaluated mortality due to COVID-19 infection relative to the size of a racial demographic in the community. And the blue bars on this graph show you the percent of the population that the demographic makes up relative to the red bars, which are the percent of mortality. So you can see that while non-Hispanic Blacks make up 32% of the Georgia population, they accounted for 44.1% of COVID-19 mortality in 2020. Likewise, Hispanics make up 10.4% of the population, however, accounted for 12.4% of the mortality rate. Compared to non-Hispanic white residents of Georgia, 50.7% of the population, but only 41.3% of the mortality rate. So we also, as a combined result of the increased risks with exposure, hospitalization, and mortality, you combine that with the unintended consequences of sheltering in place, which were intended to decrease the spread of COVID-19 throughout our communities, but it also led to loss of employment, loss of health insurance, food insecurity as schools were shuttered. And even though within Clayton County they did provide meal delivery for families during school closure, there was still an increased reliance overall on food banks. So with unemployment is loss of income, inability to pay rent. So you also have housing insecurity on top of that. And then lastly, when we look at mental health and bereavement, there was a lot of isolation, which led to increased incidents of depression, in inclinations and suicidal ideation, and the excess loss of life that was experienced in our communities also created an inability to grieve in our normal ways because hospitals were shut down. You could not visit loved ones as you had, and so you had very limited, if any, visitation. And then funerals were unsafe for becoming super spreader events. So we have an overview of why racial and ethnic minority groups have poor outcomes from COVID-19 infection. But now let's look at how Clayton County specifically correlates with those general population statistics. So with a population of nearly 300,000 people in Clayton County, 72.8% identify as Black, 13.4% identify as Hispanic or Latino. So you have a majority minority population in Clayton County, accounting for 86.2% of the racial ethnic demographics. And then you can also see that Clayton County is largely female and is very young. So you have a lot of young families, young parents, and a young population where very few residents are over the age of 65. The overall health of Clayton County, according to the County Health Rankings Report, out of 159 counties in the state of Georgia, Clayton County ranks in the bottom quartile at 125 for overall health, which is at the opposite end of the spectrum compared to our immediate surrounding counties, Fulton, Henry, and Fayette County, which rank in the top quartile for overall health in the state of Georgia. So what's driving this overall health in Clayton County? We should all be familiar with the terminology social determinants of health, but the Institute for Clinical Systems and Improvement quantifies this to illustrate the fact that approximately 50% of what determines whether a person has the opportunity to be as healthy as possible is determined by their zip code. And that's because your zip code is an indicator of your education, your employment, your income, your community safety, and your housing. Only 20% is determined by the time that anyone spends obtaining healthcare services within hospitals, clinics, and doctor visits. So when you look at Clayton County social determinants of health statistics compared to Georgia as a whole, you can see that 76.6% of our high school graduation rate is 76.6% compared to 83.8% in Georgia. Unemployment rate is 8.6% compared to 6.7% in Georgia. The poverty rate, 18.6% compared to 16.9% in Georgia. And then the eviction rate, 8.9% compared to 4.7% in the state of Georgia. So now let's enter the COVID-19 pandemic on top of that. And you can see that it's not surprising that COVID-19 was the 5th leading cause of premature death in Clayton County. And we know that there were those who wanted to compare COVID-19 to the flu in terms of its impact, but I can tell you that in previous years, influenza and pneumonia combined at best ranked at its highest as the 10th leading cause of premature death in Clayton County. So by no means would we say that flu was ever comparable in terms of its impact on loss of life. And an interesting note is that in that same year, homicide and suicide were ranked 4th and 5th leading causes of premature death, respectively. It's a sad statistic that clearly demonstrates that the pandemic took a toll on this community in ways that extended far beyond the disease itself. So we see that to address the whole person, to improve health outcomes in minority communities in particular at high risk for morbidity and mortality, that we really need to have an integrated continuum of healthcare that fosters an interdisciplinary, customizable approach to prevent disease, prolong life, and promote health through the organized efforts and informed choices of everyone who influences the conditions and places where people live, learn, work, play, and worship. That's how you incorporate social determinants of health into the space of public health. And we are all key stakeholders in directing the development of the population health policies that impact those institutions that comprise our public health and social determinants of health. So we are an interdependent community, and we're in any imbalance anywhere in the community can tip the scales from health and wellness to illness and death. But are we actually talking to each other? Are we actually engaging one another in intentional dialogue to address our common interests and concerns? Are we making assumptions about how well coordinated our efforts are? And do we have any demonstrable impact on the health quality outcomes that we're routinely measuring? So I can tell you that in the first week of December 2020, when we were gearing up to starting our mass vaccination clinics for COVID-19, the Clayton County Health Department led a countywide Zoom meeting with more than 20 community leaders representing various sectors of the community, including faith leaders, local business leaders, healthcare, education, and public safety, to discuss how we would operationalize Operation Warp Speed and strategize the setup of mass vaccination clinics, coordinating vaccine supply chain to maintain ultra cold storage of the Pfizer vaccine, and address community leader concerns ranging from vaccinating undocumented residents to providing accurate, concise, and reading level appropriate communication in multiple different languages to communicate safety and efficacy of the COVID-19 vaccines to an increasingly skeptical community, given the flurry of information that was circulating in social media and various news outlets. So as the lead coordinator for the COVID-19 vaccines and mass vaccination clinics here at Southern Regional, I was in attendance, as well as Dr. Morsees Beasley, the superintendent of Clayton County Public Schools. And it was during that discussion that he and I discovered that we had a common interest in combining our resources to educate the student population, to empower them to inform their parents and caregivers, to dispel myths and allay fears or concerns about the COVID-19 vaccine. Dr. Beasley introduced me to his K-12 science coordinator, Janetta Greenwood, and in the second week of January 2021, Janetta and I immediately began working on strategies to address the vaccine hesitancy that was percolating across Clayton County. So our collaboration began with having a common focus to improve COVID-19 vaccine confidence among Clayton County residents. We discussed ways that we could combine our resources and avoid duplication of efforts. My clinical research background and Janetta's curriculum development skills worked synergistically to obtain measurable data on vaccine confidence with diverse and age-appropriate educational initiatives and interventions. And our ultimate goal was to, and strategic interest was to ensure that as eligibility for the COVID-19 vaccines was expanding, that everyone in Clayton County would have the confidence to get vaccinated for the overall health of our community. So just like the onset of the pandemic, Operation Warp Speed was fast and furious. It involved accelerated development of the COVID-19 vaccine, resulting in emergency use authorizations for those mRNA vaccines from Pfizer and Moderna, just within 3 months of having clinical trial data analyzed. We had accelerated COVID-19 vaccine production and distribution with ultra cold storage. And then we also were expected to, at the local level, implement mass COVID-19 vaccination clinics for tens of thousands of people, administering tens of thousands of doses, and prioritizing those at high risk of exposure and mortality. But with this rapid pace of progress, it made many people nervous and skeptical about whether they could trust the novel mRNA COVID-19 vaccines for themselves, let alone their loved ones. And they actually had legitimate concerns. The rapid flow of information, misinformation, and disinformation made confidence difficult to come by. And navigating what was fact versus fiction was challenging for most people, regardless of education level. So part of what we did was conduct a survey, and it included more than 4,000 Clayton County parents of school-aged children. And they noted their top sources of information included the television, internet, government agencies, social media, and then religious and other outlets. And it's important to note that while we prize our government agencies like the CDC for being the most reputable sources of information, it only ranked third. And when you consider the internet and social media, that's largely driving people to resources that are driven by algorithms based on what information they've previously accessed. So we can see how there's a bias already in place from a communication standpoint with where they're getting their information. So with our community coalition, it was created to capitalize on the school system as a trusted source of information to increase vaccine confidence among adults and children in Clayton County, with the goal to achieve high vaccination rates among all eligible residents. So that leads us to our COVID-19 public health vaccination campaign, where the overall purpose was to improve community receptivity of taking the vaccine and provide information to support their decision making regarding the vaccine, as well as promote health awareness. The model that we employed was to start with a pre-survey to collect baseline data on their current perceptions about the COVID-19 vaccines. And then Janetta and her team developed interventions and implemented them via various platforms to educate, inform, and influence their public health best practices. And then followed by a post-survey that determined the impact of those various interventions and whether or not they shifted people's perceptions about COVID-19 vaccines. We did have two groups that we surveyed. We had the parents and guardians of students from K through 12, but we also surveyed students separately who were in grades 5 through 12. The timeline for us to push this out was that we had a pre-survey done in February, from February 1st through February 22nd, followed by the actual public health education interventions. And this was done so that we could get as much of the information into the core part of their learning program and to avoid it overlapping with the end of year activities, which start in May. So the post survey was done in May, and we did anticipate that we might have differences in response rates between the pre and post surveys just because of the timeline. But because we knew it would overlap with end of year graduation and testing conflicts. However, that was our post-survey timeline, and then afterwards we analyzed and presented our findings amongst the team in June and July. So from the beginning, our baseline data, we wanted to know what are the current perceptions, and we asked them 3 crucial questions in order to determine their vaccine confidence. So the first question is, would you get the COVID-19 vaccine today if it was available? Their percent confidence was based on whether they responded yes to the questions. And as you can see, only 32% of the parents and 35% of the students felt confident. One thing to note is that with the COVID-19 vaccine question, we did survey grades 6 through 12 with this specific question because we did not expect the 5th graders to be eligible for getting vaccinated during the course of our intervention period. So the 5th graders were surveyed for questions 2 and 3. And the second question, would you encourage someone over the age of 65 to get the vaccine? Again, parents had a low level of confidence, less than 50%, but the students actually started out with a relatively higher level of confidence to encourage older people to get vaccinated. And then lastly, would you encourage someone with diabetes, hypertension, or obesity to get the vaccine? Comparable between parents and students, but still a low level of confidence, less than 50% at baseline. So the baseline data shows that we have a lot of work to do to increase confidence, and here is where Janetta and her team stepped in with some very creative interventions to move the confidence needle higher for both students and parents.
Thank you so much, Dr. Edwards, and good afternoon, everyone. So now I will speak just a little bit about the actual interventions and the education initiatives that we created in Clayton County, because we recognize that, one, our students come to us every day and we're looked upon as a trusted avenue for information. And so we wanted to make sure that our students had informed and accurate information from us that they could also share with their families, as well as their neighbors and their community. So we created a variety of opportunities because we do recognize that students would not need just a one exposure opportunity. They needed multiple exposures to the information so that they could start to actually recognize the information, the power of information, and be able to share with others. And so we created a variety. As you can see, we had students engaging in a virtual scavenger hunt. that was focused on COVID-19. The students also had the opportunity to engage in Science's Lit Clayton Reads Challenge, Don't Miss Your Shot to Stop COVID-19 Citizen Science Project. They also created their own public service announcements. And then Dr. Beasley conducted a series of podcasts that focused primarily on COVID-19, as well as the vaccines that were becoming available at that time. So I'm going to talk about each one very briefly. Dr. Beasley, his first particular podcast that he conducted included myself and Dr. Edwards, and we had an opportunity at that point to actually share with parents, because that was our targeted audience when it came to the podcast, about information regarding COVID-19 and the vaccines that at that time was just now becoming readily available for various age groups. We also had a chance to share, because we wanted parents to recognize that their children would be engaging in some learning opportunities around COVID-19. So I specifically did share the different initiatives and interventions that the students would be engaging in, so that parents were, one, aware, but also asking their child, because once again, we recognize that our children can be influencers in their own family as well as in their own communities. So we wanted them to be asked about the things that they were doing in school in regards to COVID-19 and the vaccine. So that was an opportunity for us to have conversations with Dr. Beasley, as well as Dr. Edwards shared a lot of great information around misinformation and misconceptions around COVID-19 and the vaccination. Our Citizen Science Project was an opportunity for students to, one, recognize that they have power. And what I mean by that, they were collecting data, but that data was a collective opportunity of the students of Clayton County to see how things were happening in their own communities. And so the students were charged with taking a picture of themselves, engaging in those best practices that we know so well today around wearing masks, social distancing, hand washing, as well as opportunities and locations for vaccinations to occur. And they would post that information. And so they were able to see collectively in their community where these things were happening and how readily it was happening. And so students were engaged in a citizen science project really to see, one, the data that was current and how they can actually make changes in their community to improve that data. Our Science's Lit Clayton Reads Challenge was a challenge that was aimed at our younger age group, because we recognized that although at that time they were not eligible for the vaccine, we knew that, one, they could play a role, once again, because our parents definitely listen to what their children share about what they're learning in school. But we also recognized that if the vaccine became available for the younger groups, we wanted them to feel comfortable with getting a shot. So we recognized there was a social and emotional piece that we needed to address. So we actually curated books that students, all they had to do was click on the link and the books were already there. They didn't have to go searching for it. The parents didn't have to search for it. And the books were at a variety of reading levels. So students that were at beginning reading levels all the way up to students who were maybe reading more fluently on their own. And so we engaged in read alouds with the students, as well as had the opportunity for students to share what they learned from their own readings. That opportunity to share was conducted through our Jeopardy game. So our students had a chance to compete to demonstrate what they learned around reading about COVID-19 and around the vaccine itself. And so students only had to read 3 books in a row to be eligible to compete in the Jeopardy game. And then they won some wonderful prizes based on their score at the end of the Jeopardy game. And this was a district-wide competition. We also had a lot of other opportunities for students to win prizes and be recognized for the work that they did in the Spring Into Action, because that's what we called it, because of course it was around spring break. And we recognized that this was a vital time to, one, become informed so students can make very knowledgeable decision making at that time around spring break. But we also wanted them to have something that they could put back into their community to show that, hey, we're doing something that make a difference in our community around COVID-19. And so we also wanted it to be used as a way to prompt conversations. So every student that participated in our COVID-19 Spring Into Action Challenge and actually won, received a sign, a yard sign, to put either in their yard or in their window to once again spark conversations around COVID-19 and the vaccines that were coming available. And then also we wanted parents to have access to information, because once again, this was at the time where things was just still becoming available for various age groups, and parents were not readily knowledgeable about where they could get the vaccine, who was eligible, what was needed in order to receive the vaccine. So we made sure that on our website, we provided those resources, not only for locations in Clayton, but across the metro area, because we recognize not all parents work and play in Clayton, and we wanted them to be able to get access to what they need wherever they needed it.
So you can see the amazing work that Janetta and her team incorporated in the Clayton County school systems through their science curriculum at all levels. And so now let's take a look at what impact that had on our post-survey results. So as I mentioned earlier, we had a timeline for when we wanted to implement our post-survey, and it was delayed by 1 week. We planned for May 1st, but it got out about a week later due to challenges from a scheduling standpoint that overlapped with different conflicts. However, you can see that we still had a pretty sizable response rate with the parents and students, even for the post-survey. And these results were statistically significant in terms of the change from their baseline perceptions of the COVID-19 vaccine before those interventions and after those interventions. Would you get the COVID-19 vaccine today if it was available? This was by far the most dramatic increase that we saw in their perceptions and their confidence level in getting vaccinated for themselves. The parents went up to 50% in terms of their confidence level, and the students went from 35 to 51% in their confidence level over the course of the school year, the second half of the school year. For the second question, we also see notable increases in their confidence to encourage those who were age 65 and older to get vaccinated. Again, the parents made a huge jump in terms of their level of confidence. And as well, the students, they started with a higher level of confidence, but again, we did still see great movement in terms of their level of confidence to encourage those age 65 and older to get vaccinated against COVID-19. And then question 3, would you encourage someone with diabetes, hypertension, obesity to get vaccinated? Again, we do see that there was definitely movement in the positive direction that was significant between pre-survey and post-survey, their perceptions before and after those interventions. And so all of that work that we did within the Clayton school system from January through May really laid the groundwork and prepared the landscape for our latest ongoing initiative, which is Clayton Calling the Shots, the Get Vaxxed campaign. In May 2021, Southern Regional Medical Center partnered with Clayton State University School of Nursing to co-author a grant that was submitted to the Health Resources and Services Administration for the purpose of increasing vaccination rates in Clayton County, which at the time of the writing of the grant was only at 8%. In July, we were awarded that grant. Southern Regional was awarded over $995,000 to increase vaccination rates from that 8% to at least meet or exceed the Georgia rate of vaccinations. So through that grant, we actually expanded our coalition in the county to continue informing, learning, and encouraging the decision-making process for Clayton County residents to get vaccinated. So these are just several photos of us and the team, some of the team members, and from people from the community who did make that decision to get vaccinated against COVID-19 infections as a result of the Get Vaxxed campaign with Clayton Calling the Shots.
So as Dr. Edwards mentioned, we had such a great response to the initiatives and interventions that we did in the spring. I was asked again in August to revisit the opportunity for our students to engage in being social influencers and also having opportunities to learn more information and become more educated about getting vaccinated, because at this time they were currently eligible to receive the vaccine. So we had a couple of different initiatives. So that as you can see there on the screen, the students engaged in, once again, a public service announcement challenge, but this time the focus was actually on getting vaccinated. The students also had the COVID-19 vaccine passport challenge, which I'll explain a little bit more. And then they once again engaged in the citizen science project as well. So the vaccine passport was one of our, I think, one of our best initiatives that we did in the district. And the students, as you can see, received an actual passport booklet that we created, that all they had to do was get signatures from 5 or more people where they actually engaged in conversation with those individuals about the vaccine, locations where they get vaccinated, COVID-19 itself, as well as best practices around stopping the spread of the virus. And so the students were given the booklets, and they actually were given inside the booklet little tidbits of information to share, because we wanted them to share accurate information. So in this particular booklet, the students were able to, once again, go into their community, share information, factual information, actually become basically public health educators in their own right and social influencers. The students that actually obtained 5 or more signatures were able to be entered into a drawing, and some of the students who won TVs, gaming systems, and gift cards. So there definitely was an incentive there. The targeted audience for this particular initiative was grades 6 through 12, and it was implemented in all science classrooms. Our second initiative was for our K-5 students, because although at the time that we launched this, they were not eligible, we recognized that that eligibility was coming, and it was coming relatively sooner than later. So our students were engaged in a K-5 vaccine puppet show PSA challenge. And in that particular initiative, we hired a artist, and the artist actually created a vaccine puppet show, but she focused on not just information around the vaccine, but we also addressed the social emotional piece, because we recognize, once again, our babies were going to have to get a shot, and they may not have gotten a shot in a little while. So we wanted to make sure that they were comfortable and understood what that meant, but also how the vaccine itself was going to give them the superpowers that they really needed to combat the virus. And so that particular challenge was won by our King Elementary School. And as you can see, there's a little snapshot of their puppet show that they put together, and they video recorded for us. And I actually share that with you all later in the resources that we're providing after today's session. Also, we moved towards doing more school vaccine clinics, and this was a huge component of the Get Vax collaboration that we engaged in with the various entities in Clayton County. And so we wanted to, one, make sure we provided information that was readable and written in a way that both students and adults could understand and relate. So we created some informational flyers, but we also enacted our mass vaccination targeted locations. And so as you can see, that started around December, and we knew that we were going into the time of year where holidays, parents were going to be traveling with their families, and we wanted to be proactive in anticipation of the return that would occur in January. So we wanted to make sure that parents had access to get the vaccination if they so choose. And then this also shows our timeline as we expanded those options and opportunities for parents. So once again, notice that in August, we did mass vaccination drives. We did a couple there. In September, we moved towards more school-based vaccine clinics, because at that point, students were becoming eligible to receive the vaccine. And then in December, once again, right back to those mass vaccination drives as we were moving into those holiday vacation times. And then in February, when the eligibility opened up to our younger babies in grades K through 5, we recognized the opportunity to do what we call Vaccine Fridays, because we didn't want the potential side effects to impact the students where it impacted their educational day. And so we looked at Fridays on that last day of school for the week, so that if there were any impact, it would happen over the weekend. And then now what we're currently working on is ensuring that parents have access to booster shots. We also did a Get Vax town hall, and that town hall included myself as well as Dr. Beasley, Dr. Collier, who was our Director of Student Services, as well as Dr. Reddy, and a variety of other key people to talk about vaccinations once again, and the impact that it was having on Clayton County, and how we all could play a role in changing that trajectory and really improving the overall health outcomes for our community. And then lastly, Dr. Beasley once again did another podcast in his series. And this particular podcast was with Dr. Collier, our Director of Student Services, as well as Dr. Reddy. And they once again just really addressed some of the things that was happening currently in regards to COVID-19, because at that time we were starting to see more variants, and parents and students needed to understand what variants actually meant and how that impacted them differently, potentially from the original COVID-19 virus. Even though things have slightly changed from our initial process, we learned through this whole process how well our students work as public health educators. And we saw an opportunity to make a connection between the work that they were doing and careers. And so we, as part of the Get Vax initiative, our Career Technical Agriculture Department, CTAE, decided to put together opportunities through workforce development and developed a program called Student Public Health Educators. And this particular initiative is actually being funded through the grant, so the students are actually being paid for the work that they're doing around educating their peers, as well as educating their neighborhood, their family, as well as adults in Clayton County. And so this is how we're going to continue to move forward, because we realize the work is not done. And we also realize the power of what students can do in their own right. And so we wanted to show them that this could be a career option for them, as well as allow them to see how they can make an impact on their own respective communities.
So the impact of our community coalition really has been speaking for itself with the results that we've obtained in just such a short period of time. You can see that we've increased the COVID-19 vaccination rates in Clayton County from just 16.3% in August 2021 to now 49.85% in May of 2020. And so we are within striking distance of the Georgia average, which is 53% fully vaccinated against COVID-19. We've also expanded access to vaccinations for all eligible age groups with school-based vaccine clinics. And we created innovative student engagement programs to improve the community confidence in COVID-19 vaccines. So I just strongly encourage anyone who is interested in learning more about Clayton Calling the Shots to visit our website at www.claytoncallingtheshots.com, and you can see more information about the initiative, our partners, vaccine education, and the upcoming events that we have in our community. So now that you can see how vital community-based coalitions are to be successful and to obtain successful health outcomes in marginalized communities and populations, I want to leave everyone with this thought. We can't just say it takes a village, we need to be the village. We are all included and are integral to the health and well-being of our communities. We need to become intentional with forging collaborations with all the major institutions that form the framework of our communities in order to improve the health and well-being for everyone. So thank you so much for giving Janetta and I this opportunity to share our story. Any questions?
Janetta, thank you. That was incredible. A lot of good comments coming in regards to this work, and really just amazing results and the data and the work that's been done. Thank you all for sharing. So everyone, as you have questions, just a reminder, put them in the chat and we will get to them. Want to kick a few off if that's okay. How do y'all, are there best practices here from this this initiative that you think will now flow into other initiatives, right? So it made a big impact on COVID vaccine compliance. I know there's other community health concerns, whether it's other vaccinations, eating habits, going to the doctor regularly, all those kind of things. Do you see any carryover from this into other work? Does that make sense?
Yeah, absolutely. So I'll just start by saying that one of the things that when I mentioned the whole point of being intentional. We all had to band together because of COVID-19, but now it's time to kind of take what we know to be the issues of our community immediately and start being intentional with forging and putting out their meetings with key stakeholders from different institutions that comprise the framework where you know that people are constantly interacting and engaging with. So having and this can be initiated either through the healthcare system, through public health, through the education system, but we all need to start with having a community meeting that says, this is a problem that concerns all of us, and what are some ways that we can go about tackling this to make sure that we impact what information they know, educating the community about this topic, or getting them access to resources that make it easier for them to get healthy, stay healthy, pulling in other business leaders as well. So not just education or nonprofit, but any community business leaders, to get them engaged in having a conversation, because when you start having the conversation, that's when creative and innovative ideas start to come forth. Things that you might not have originally thought as possible from a health system or hospital scope now become very possible and doable just because other people in their respective disciplines and industries say, hey, how about this? And so being open-minded about the possibilities of what you can do when each entity involved in the conversation brings their respective intellectual property and resources to the table to achieve that common goal and focus.
And I would just add the power of the school system, because when you're thinking about a community, that is some commonality right there, where most either their own child goes to school or they know someone who has a child who goes to school. So it's a wonderful opportunity to get information out. And school systems are trusted. I say we're trusted because they leave their kids with us for 8 hours every day. So we are a trusted piece of their life. And so it's a wonderful opportunity when you can partner with a school system to help support whatever the initiative may be.
Absolutely. Have y'all had an opportunity, just curious, is there a network where y'all can share some of this great work with other school districts, either throughout Georgia or the country?
Absolutely. I'm glad you asked that question. I'm currently the president of the Georgia Science Supervisor Association. And so we meet pretty regularly throughout the academic year. And this information, as well as other information, is shared with the science supervisors. So that's one way that and we do allow outside entities to come and present and talk to all the science supervisors across the state of Georgia. So that's one opportunity, but there's a lot of different other organizations similar to that where you can utilize that same connectivity across the state. Absolutely.
Thank you. And I have to give credit. William Watkins prompted me for that question. Thank you, William, for that. Wondering, as leaders on this call, if we all are looking to ways to better do community health. I work at a community not-for-profit hospital. How can we create some of these community-based coalitions? How do we get started in our area potentially in finding these types of partners to promote public health like this?
Well, one place that you can start is by identifying who the key stakeholders are in your committee. Oftentimes, you're involved in things like either Rotary clubs, your Chamber of Commerce, starting with who you know are key people in your community that would be willing to come to the table to start having conversations around the shared topic of improving community health. And knowing that just as a starting piece, and you will have times when the coalition will involve certain entities and not others, but you definitely want to make sure that you're pulling everybody to the table to start with the conversation that says, this is something that's impacting our community, and this is how it's impacting your business. This is how it's impacting your school system. This is how it's impacting, and so everybody can relate and start kind of pulling the conversation into this is how it's impacting everyone. And now let's consider discussing how we can have conversations around implementing innovative strategies. And then the other thing that I do want to bring up, and you kind of referenced it, during my bio introduction is that keep in mind that the Department of Public Health, they have broader scopes of public health initiatives that they may need to align with health systems and education on, but they don't necessarily know how to coordinate getting everyone together to think and talk about those things. But they come with grant funding available that even when you're talking about pooling resources, oftentimes you can just partner with the public health sector to say, hey, this is something we want to do, which we know benefits a public health initiative. And then you might be able to find opportunities for grant funding to do something purely innovative, but that's impactful, that will actually drive the outcomes and the results in your community. So just be aware that especially when you're a not-for-profit hospital, that really does open up the door for state, local, and federal funding to do things that your otherwise operational budget would not be able to handle.
Yeah, that's a great point. Great point.
Yeah.
Well, curious so a lot of great data around the interventions that were made and an increase in the vaccination rate, substantial increase in vaccination rate. I'm curious on, and I know you didn't measure this necessarily directly, and I'm kind of putting you on the spot with just kind of your opinion on it. But I would think that one of the other downstreams of this would be it helps educate people on how to understand, factual information from opinion information.
Mm-hmm.
Did you see that through these initiatives and helping just the students be able to differentiate of what is real factual based versus what is, I just read a headline on social media?
So I'll speak a little bit from that perspective. So that is actually one of our primary goals, just when it comes to science education and some of the standards that we're responsible for teaching, as well as I'll even bring up social studies. And so part of that work is also always about how to decipher from facts from things that maybe are not based on facts. So one of the core things that we teach our students is it has to be based on evidence and what makes it valid evidence and reliable evidence. And so I think that is very important. We saw, I think COVID-19 kind of revealed how that was not as high up in our community in regards to determining what was valid and reliable information. And so we as a school district have been put more intentional focus on making sure that students understand how to decipher that across all contents. So they're getting it in multiple classrooms, not just in science, not just in social studies, but also in math, ELA, and even their electives, because that is a core tenet of our students being successful as they move forward.
Sure. It seems like, given the instant access to opinion and 24-hour news cycle, that's really important skill to develop for probably this generation coming up, even more so than like mine. So pretty interesting problem to tackle or skill to develop. So thank you for that. What are do you have next steps for the program? Do you continue it? Do you around the vaccine? I know you got up to pretty close to the state average, but do you effort continuing?
Absolutely. So we still have ongoing funding support through HRSA through next calendar year through the end of 2023. But the initiative itself is kind of taking on a bit of a life of its own of sorts. So we've gotten so much traction from everything that we've done that this will probably be kind of an ongoing Clayton County initiative for the foreseeable future. And to your point earlier with one of your questions, expanding into other areas, because we do have COVID-19 or the pandemic, and we're kind of at a sort of a steady state of sorts. The one other thing that I would say we could expand into, which is a specific statistic, again, here in Clayton County, is with respect to maternal and infant mortality rates. Again, we know that minority women, especially Black women, are dying at a higher rate compared to white women in childbirth. We know that we also have a community that may have teen or young pregnancy rates. We want to make sure that with our Women's Life Center that we have here, that we can also venture into other community-based programs that take what might be happening in the school systems or in the community and connect it to the resources that we have within our healthcare system to actually improve those outcomes, improve the quality of perinatal, prenatal care, improve the education, improve access to resources that will help new moms become great moms and supportive. And so those are kind of the ways to start thinking outside of the box in something that might be specific to your community, that is a metric that you know you need to improve. No, it's not a CMS greater than 65 or older metric, but it is something that's important to the community. And sometimes when you deal with those things that are most important to your community, by default, you get funding and support that has tangential and other benefits in those other areas that you do look at from a, hospital system management bottom line standpoint.
And I'll just add, mental health is also a challenge right now, particularly in Clayton County. If you remember the data that Dr. Edwards showed, suicide rate and homicide was kind of at the top 5 things that were leading to death in our community. And so we recognize that COVID-19 may have had some impact on that. So that's definitely something that will be a focus of this upcoming year for us, as well as, if you remember, I mentioned we have the public health educators. And so those students are actually interning for me this summer, working in our different summer programming, and they will be engaging once again, working with the community and the parents, as parents are dropping their kids off for our summer programs, as well as picking them up. So we're definitely continuing with this initiative.
Yeah, and I want to tag on one thing just based on what Janetta said about the mental health. And this is a plug that maybe some of you know about or not, but about a month or so ago, Senator John Ossoff was here at Southern Regional Medical Center because he was able to get us $1.1 million in funding to open and expand a crisis stabilization unit for substance abuse and mental health. So that's part of what I mean by when you're focused on what's important from a public health community standpoint, you can actually get access to resources that can build out your infrastructure to provide services that downstream will have an impact on other health metrics in your community.
Absolutely. Ladies, well said. Fascinating, really amazing work. I know you're both very proud of it, but you should see I hope you've seen the comments coming in. It'll just make you feel good about the work you're doing, as just being recognized that this is tough work, important work, and pretty incredible. So thank you both, and thank you both for joining us today. I want to close us out here. I'm sure, Dara, Janetta, if we have other questions come in, is it okay to connect you with anybody who may have further questions?
Absolutely.
We'll do that. So thank you both again for being here. And I'm going to close this. Again, just want to thank our sponsors. I know we shared those earlier. We really do appreciate every one of them for helping us put on great programs like this today. Everyone on here will also get a meeting evaluation survey emailed to you. Please take the time to fill that out. We do look at those and continue to work to make sure that the programs are meeting your needs. So please give us your feedback there. And again, don't forget to go on to ACHE website, log in, and put in today's hour of qualified credit. And we appreciate everybody. Have a great afternoon, and we look forward to seeing everybody at our next event. And Dara, Janetta, again, thank you both for joining us today.
Thank you for having us.
Thank
Have
you
a great
so much.
afternoon, everyone.
Thanks, everybody.
Thanks.